Hi, I'm Dr. Daniel Kamen, DC, author of this book called The Well-Adjusted Horse, Equine Chiropractic Methods You Can Do. Right now I want to show you a little bit about why the first and second cervical vertebrae are the most important vertebrae to adjust, because they have the most natural movement. So this over here would be horse skeleton. This would be an atlas. This does not belong to this horse. But over here you see the occipital condyles and the base of the skull, or the occiput, and the atlas fits in here. And the movement between the atlas and the occiput, called the atlanto-occipital joint, is called the yes joint. So it allows for the horse's nose to go up, which is extension, and the horse's nose to go down, which is forward flexion. So this over here is called the yes joint. Okay? Now, this over here, again, would not be from that horse. So this over here would be the atlas. This is actually of a cow. This over here would be the base of the skull. The horse's nose is over here. And the movement, again, would be this movement right over here, the yes joint. Nose up and nose down. And there's a lot of movement in this direction right there. Okay? Now, when you talk about the axis, or the second neck bone, so again, here is the atlas. Here is the axis, or the second neck bone. This is called the no joint because it allows for the rotation of the head this way, or this bone. So this is called the yes joint, where the atlas meets the base of the skull with those two occipital condyles in there. And this is called the no joint. So there is a lot of movement where the atlas and C2 meet, and there's a lot of movement where the atlas and the base of the skull, or the condyles, meet. And that's why if there's an injury, or if the horse trips, the first vertebra to get a natural body splint, which is a muscle spasm, would be the joints that have the most natural movement. So this has a lot of movement right here, and the axis, or the second neck bone, has a lot of movement where it meets the atlas right there. However, when you get to the third cervical vertebra, okay, these joint facets fit in here like this, and you can see how restricted the axis, or the second neck bone, is below, right over here. So the atlas has the most movement of any cervical vertebra. The axis, or the second neck bone, has the second most movement of any cervical vertebra. And from C3 down to C7, the rest of the bones are restricted like this. So in case you're not sure which vertebrae to adjust, there are some tests that I show you how to do in my book and in my videos, how to test for the atlas misalignment and how to test for a C2 misalignment. There are also moves to test for a C3 down misalignments as well. But the first two cervical vertebrae, the atlas and the axis, have the most natural movement, therefore they're the first ones to misalign.